sabik sa unang araw ng eskwela. Taas kamay with confidence, let's do the first day high! Iba't iba ang hilig, magkakasundo sa trip. Kung gusto mong sumama, welcome ka mag first day high! First day high! First day high!
May 6 na estudyante na nag-aaral or perhaps nagrereklamo sa ilalim ng librada hall about sa cardiovascular system. Naghahanda kasi sila para sa nalalapit nilang report. Tila ba'y pakiramdam nila na magugunaw na ang mundo. Member 1, Jamie Cruz, the laging puyat 1.
Circulatory system? Dami naman nito.
Member 2, Mika Babehis, the overthinker 1. Mahilig mag-aral pero uunahin muna magreklamo.
Ano nga ulit yung part ko? Oh no! I need to stop it talaga. Dami so much.
Member 3, Cristina Jose, ang studentista na okay lang nakulelat basta maganda.
Dami parang hindi pa tayo ang shadow ko. Siguro kasi Taylor Swift yung teacher ko. Dadaysay ko sarili ko sa parts na
Member 4, Abigail Tolentino, the studentista chill 1. Yung tipong sabay lang sa trip ng buhay. Like, pasado? Thank you Lord! Bagsak? Bawi na lang next life? Yung mga ganong tipo ba? Member 5, Alain Andal, the papogi 1. Hilig-hilig sa babae, pero kulelat naman sa class. What if bagsak ko kaya to?
What's up, guys? Sorry, late. It's short here. Hindi ko sana yung number kasi. So, gagawin natin. Lagi mo ka ako sa vertical kasi kapag kainan ko ka,
Ako naman ay si Josephine Ramos, last member, the serious 1. Seryoso sa buhay at seryoso sa pag-aaral. Handa rin seryosohin ang cardiovascular.
mahirap. Pagod ka. Mag-aaral. Pinapagod na pa.
Oh no, this can be happening.
Broken? May connection ba ang pagiging broken sa cardiovascular system? Well, there are 2 divisions in our circulatory. First is the cardiovascular system, and the second one is the lymphatic system. But now we'll focus on the general anatomy of the cardiovascular system. The cardiovascular system is also known as our circulatory system. It consists of our heart, which is a muscular pumping device, a blood, and the closed systems of blood vessels, which are called arteries, veins, and capillaries. So what are the functions? The functions is to transport oxygen, hormones, nutrients, and it removes waste products like carbon dioxide throughout the entire body. It plays an important role in helping the body to meet the demands of activity, exercise, and stress. It also helps the body to maintain its temperature, among other things. So now let's go on to the main organ of our cardiovascular system.
The heart is a network of blood vessels that pumps blood throughout your body. It also works with other body systems to control your heart rate and blood pressure. Your family history, personal health history, and lifestyle will affect how well your heart works. So what is the heart's function? The heart's main function is to move blood throughout your body. And your heart also controls the rhythm and speed of your heart rate and maintains your blood pressure. Your heart is located between your lungs, in the middle of your chest, behind and slightly to the left of your breastbone. Your heart is slightly on the left side of your body. It sits between your right and left lungs. The left lung is slightly smaller to make room for the heart in your left chest. A double-layered membrane called the pericardium surrounds your heart like a sac. The outer layer of the pericardium surrounds the root of your heart's major blood vessels and is attached by ligaments to your spinal column, diaphragm, and other parts of your body. The heart weighs between 7 and 15 ounces and is a little larger than the size of your fist. By the end of a long life, a person's heart may have beat, expanded, and contracted more than 3 billion times. You can feel your heartbeat anytime you touch your chest. Do you have any idea what's really going on your heart? Every day, your heart beats about 100,000 times. Food, water, and oxygen are essential for the existence of human life. And did you know that our heart is a pumping system which is composed of muscles that pumps blood toward the body?
Come and go on the structure of the heart. The inside and outside of your heart contains components that direct blood flow. The heart is divided into the left and right. The two sides are separated by the septum. The human heart has 4 chambers: the right atrium with the right ventricle and the left atrium with the left ventricle. You have seen the structure of the heart. So let's go on the blood. May I call on Mr. Andal?
Red blood cells, or RBC, or erythrocytes, deliver oxygen from your lungs to your tissues and organs, while white blood cells, WBC, or leukocytes, fight infection and are part of your immune system. The types of WBC includes lymphocytes, monocytes, eosinophils, basophils, and neutrophils. Platelets, also known as thrombocytes, help blood to clot when you have a cut or wound. Bone marrow, the spongy material inside the bones, makes new blood cells. Blood cells constantly die and your body makes new ones. Blood cells is formed in the bone marrow that starts out as stem cells. A stem cell is the first phase of all blood cells. As the stem cell matures, several distinct cells evolve. This includes red blood cells, white blood cells, and platelets. Immature blood cells are also called blasts. Some blasts stay in the marrow to mature. Others travel to the other parts of your body to develop into mature, functioning blood cells. Our red blood cells live about 120 days, and platelets live about 6 days. Some white blood cells live less than a day, but others live much longer. There are 4 blood types: A, B, AB, and O. Also, blood is either Rh positive or Rh negative. So if you have a type A blood, it's either A positive or A negative. Which type you are is important if you need a blood transfusion, and your Rh factor could be important if you become pregnant. An incompatibility between your type and the baby's could create problems. Blood carries the following to the body tissues: nourishment, electrolytes, hormones, vitamins, antibodies, heat, oxygens, and immune cells that fight infection. And blood carries the following away from the body tissue: waste matter, and carbon dioxide. These are some blood conditions. Anemia, an abnormally low number of red blood cells in the blood. Fatigue and breathlessness can result, although anemia often causes no noticeable symptoms. Hemophilia, an inherited deficiency of certain blood clotting problems. Frequent or uncontrolled bleeding can result from hemophilia. Hematoma, a collection of blood inside the body tissues. Internal bleeding often causes a hematoma. Leukemia, a form of blood cancer, in which white blood cells multiply abnormally and circulate through the blood. The abnormal white blood cells make getting sick from infection easier than normal. Sickle cell disease, a genetic condition in which red blood cells periodically lose their proper shape, appearing like sickles rather than discs. The deformed blood cells deposit in tissues, causing pain and organ damage.
Now, we go on the blood vessels. The blood vessels have 3 layers of tissues, except for the capillaries. Capillary only have tunica intima, while the arteries and veins have the following tissues. The first one is the tunica intima. The inner layer surrounds the blood as it flows through your body. It regulates blood pressure, prevents blood clots, and keeps toxin out of your blood. It keeps your blood flowing smoothly. The tunica media is the middle layer, contains elastic fibers that keep your blood flowing in one direction. The media also helps vessels to expand and construct. The last one is the tunica adventitia. The outer layer contains nerves and tiny vessels. It delivers oxygen and nutrients from your blood through your cells and helps remove waste. It also gives blood vessels their structure and support.
The arteries are the blood vessels that deliver oxygen-rich blood from the heart to the tissues of the body. Each artery is a muscular tube lined by smooth tissues, and it has 3 layers: the tunica intima, tunica media, and the tunica adventitia. It is a tube-like vessel and the muscles inside our body. The total thickness of the wall in arteries is around 1.0 millimeters, and the internal diameter of around 4.0 millimeters, except into aorta, as this consists of 10 millimeters of wall thickness and internal diameter of 25.0 millimeters. It is because of the high pressure generated by the heart. The arteries play a crucial role in distributing oxygen, nutrients, and hormones throughout the body. It also keeps our body alive and healthy by delivering what our cells and tissues need. The arteries consist of 3 layers: the tunica intima, tunica media, and the tunica externa. The tunica intima, or inner layer, it consists of tissues with elastic fiber and also has a simple squamous epithelium surrounded by a connective tissue basement membrane with elastic fibers. On the other hand, tunica media, or the middle layer. This is mostly smooth muscle that lets your arteries get tighter or more open as needed. Thicker in arteries, particularly in the large arteries, and consists of smooth muscle cells intermingled with elastic fibers. The muscle cells and elastic fibers circle the vessel. In larger vessels, the tunica media is composed primarily of elastic fibers. As arteries become smaller, the number of elastic fibers decreases while the number of smooth muscle fibers increases. Lastly, the tunica externa, or the outer layer. This interacts with other tissues, including nerves that send commands to pull or to expand. It is the strongest of the 3 layers. It composed of collagenous and elastic fibers. The tunica externa of the artery also provides a limiting barrier, protecting the vessel from overexpansion. Also, characteristic of this layer is the presence of small blood vessels called vasa vasorum that supply the walls of larger arteries and veins. In contrast, the inner and middle layer are nourished by diffusion from the blood as it is transported. The thicker, more elastic wall of arteries enables them to expand with pulse and to regain their original size. The amount of muscle and elastic tissues varies in arteries depending on their size. We have the large arteries. This consists of more elastic tissues than the smooth muscle. Our artery carry blood that has oxygen and nutrients in it. Our heart pumps oxygen-rich blood into the biggest artery in our body, the aorta. Aorta is the largest blood vessel in the body. This artery is responsible for transporting oxygen-rich blood from our heart to the rest of the body. The aorta begins at the left ventricle of the heart, extending upward into the chest to form an arc. It then continues downward into the abdomen, where it branches into iliac arteries just above the pelvis. It has different parts. The first one is the aortic root. It is the portion of the aortic root that is attached to the heart. We have the ascending aorta. It begins at the sinotubular junction of the aortic root and extends up and out from the heart until it connects with the aortic arc. The aortic arc. It is in the shape of an arc and connected the ascending aorta with the descending aorta. Lastly, the descending thoracic aorta. It begins at the end of the aortic arc and continues down into the abdomen. It has two types. The thoracic aorta. It runs from the aortic arc to the diaphragm, which is the point of the separation between the chest cavity and the abdominal cavity. It also provides blood to the muscles of the chest wall and the spinal cord. Lastly, we have the abdominal aorta. It runs from the diaphragm and ends just above the pelvis, where it divides into the iliac arteries. We also have the smaller arteries. It consists of more smooth muscles than the elastic tissue. It is what we call the arterioles. Arterioles is a small blood vessel that carry blood away from the heart. It is also the connectors between the arteries and capillaries. It also controls our blood pressure and the blood flow throughout our body, using their muscles to change their diameter. They also link to capillaries to exchange oxygen, nutrients, and waste. There are two types of arteries, although both of them have a role in carrying oxygen-rich blood from our heart to our body's tissues. The two types of arteries are the elastic and the muscular. The first type is the elastic. It is like when a football player catches the ball, absorbing the force from the throw. The elastic arteries is the type that gets our blood from our heart before passing it into the other arteries. The elastic consists of more elastic tissue than muscular arteries and are located close to our heart. The example of these are aorta and pulmonary artery. On the other hand, imagine running down on the field with the ball, getting it to where it needs to go. This is what the muscular do into our body. The blood is going to our body's tissues. It has more smooth muscle than elastic arteries. The examples of muscular are femoral, radial, and brachial arteries. The artery provides blood to the organs of certain body parts, such as, for the heart, the blood is provided by the coronary arteries. For the brain, head, face, and neck, it is by the carotid arteries. For the brain and spine, it is by the vertebral arteries. For the pelvis, it is by the iliac arteries. For the legs, it is by the femoral artery. For the head, neck, and arm, it is by the subclavian artery. And lastly, for the digestive system, it is by the celiac and mesenteric arteries.
Veins and arteries share its general structure. However, veins are different from arteries because they sometimes also contain one-way valves that keep the blood flowing in the right direction. These valves are especially important in your legs where they help blood move up towards your heart. If these valves get damaged, blood can leak backward and cause varicose veins or other problems. Veins are also different from arteries when it comes to the thickness of their walls. Veins have thinner and less muscular walls. This is because veins have a lower level of pressure in comparison to arteries. So, their walls don't need to be as thick to handle the pressure.
There are three different types of veins in our body. And these three types helps your circulatory system to function. These are the deep veins, superficial veins, and perforating veins. Let us first have the deep veins. Deep veins can be found in your muscles and along your bones. Your deep veins do the important work of moving your oxygen or blood back to your heart. And in your legs, your deep veins hold about 90% of the blood that travels back to your heart. Your deep veins contain one-way valves that keep your blood moving in the right direction. This includes the brachiocephalic vein, a pair of large deep veins in the upper chest. You have deep veins in the upper extremities. You have ulnar vein, radial vein, axillary vein, and subclavian vein. The lower extremities, in proximal, have inferior vena cava, common iliac vein, internal iliac vein, external iliac vein, femoral vein, and popliteal vein. In deep distal veins, there are gastrocnemius vein, anterior tibial vein, soleus vein, and posterior tibial vein. Next is the superficial veins. These are generally smaller than your deep veins. Like deep veins, they contain valves. But unlike deep veins, they are not surrounded by muscles. Instead, your superficial veins can be found just underneath your skin, so you can easily see them. Your superficial veins carry blood from your outer tissues near the surface of your skin to your deep veins via perforating veins. But this blood moves more slowly since it's not being directly squeezed into motion by the surrounding muscles. So the large vein in your body is a superficial vein. It is called the great saphenous vein. It runs all the way from your ankle to your thigh in each leg. We have internal jugular vein and internal jugular vein in the neck. The upper limb, we have cephalic vein, median cephalic vein, basalic vein, and median cubital vein. The lower limb, we have great saphenous vein, long saphenous vein, short saphenous vein, and this tree gives or tends to give rise to varicose veins. So now let us have our last type of vein, the perforating veins. These veins are sometimes called connecting veins or perforator veins. They are short veins that carry blood from your superficial veins to your deep veins. Perforating veins contain valves that close when your calf muscles compress so that blood doesn't flow backward from your deep veins to your superficial veins. Now, there are two types of perforating veins, the indirect perforating vein and the direct perforating vein. The indirect perforating vein connects deep and superficial veins through muscular veins, while the direct perforating vein connects deep veins directly with superficial veins. So now let us discuss the differences of arteries and veins.
Veins and arteries have the same three layers, the tunica intima, tunica media, and the tunica adventitia. But the difference is that tunica media of the arteries are thicker compared to veins. Now let's see the difference between the arteries and the veins. For the arteries, it has more muscle and elastic tissue. It also retains their cylindrical shape and take oxygen-rich blood away from our heart and distribute it to our whole body. It also has strong muscular walls that can handle the high pressure of blood our heart pumps out with each heartbeat. Lastly, it don't need valves because the force of the blood coming from our heart ensures the blood only goes in one direction. But on the other hand, the vein has less muscle and elastic tissue, and it also collapses when it is cut. It brings blood back to our heart after our body cells and tissues have taken the oxygen out of it. The veins also have thinning walls because the pressure inside them isn't as high as it is in the arteries. Lastly, this has valves inside them to keep the blood from moving in the wrong direction.
Now, let's proceed to capillaries. Capillaries are the smallest blood vessels in the body connecting the smallest arteries to the smallest veins. These vessels are often referred to as the microcirculation because they deliver oxygen and nutrients to all cells in the body and remove carbon dioxide to be eliminated. Capillaries are very thin, approximately 5 micrometers in diameter and composed of only 2 layers of cells. The inner layer is made up of endothelial cells. They are so small that red blood cells need to flow through them single file. It's been estimated that there are 40 billion capillaries in the average of human body, and they stretch over 100,000 miles if placed in a single line. Surrounding this layer of cells is something called the basement membrane, a layer of protein surrounding the capillary. Why are capillaries very small in size? Well, capillaries need to be small in order to facilitate oxygen and carbon dioxide gas exchange in cells. They also play a role in fluid and nutrient exchange, forming the connection between the body's smallest arteries, arterioles, and the smallest veins, venules. They play a different role than veins, which return blood to the heart, and the arteries that pump blood out to the body. Capillaries are found throughout the body and may be thought of as the central portion of circulation. Blood leaves the heart through the aorta and the pulmonary arteries, traveling to the rest of the body and to the lungs respectively. These large arteries become smaller arterioles and eventually narrow to form the capillary bed. From the capillaries, blood flows into the smaller venules and then into veins flowing back to the heart. Number of capillaries varies by tissue type. The number of capillaries in a tissue can vary widely. Certainly, the lungs are packed with capillaries surrounding the alveoli to pick up oxygen and drop off carbon dioxide. Outside of the lungs, capillaries are more abundant in tissues that are more metabolically active. And here's the type of capillaries. The capillaries in the body include 3 primary types. These capillary types are called. First is the continuous, because these capillaries have no perforations and allow only small molecules to pass through. They are present in muscle, skin, fat, and nerve tissue, fenestrated due to small pores in the capillaries that allow small molecules to pass through. They are located in the intestine, kidneys, and endocrine glands. Sinusoidal or discontinuous, a type of capillary with large open pores, large enough to allow a blood cell through. They are present in bone marrow, lymph nodes, and the spleen, and are in essence the leakiest of capillaries. The next one is blood-brain barrier. Capillaries in the central nervous system make up what is known as the blood-brain barrier. This barrier limits the ability of toxins and many chemotherapy agents and other medications to pass through into the brain. Looking for drugs that can pass through the blood-brain barrier and hence treat conditions such as brain metastasis from a number of cancers is an active area of research. The next one is capillary function. The capillaries are responsible for facilitating the transport and exchange of gases, fluids, and nutrients in the body, while the arteries and arterioles act to transport these products to the capillaries. It is at the level of capillaries where the exchange takes place. The capillaries also function to receive carbon dioxide and waste products that are then delivered to the kidneys and liver for waste and the lungs for exhalation of carbon dioxide. And the next, and gas exchange. In the lungs, oxygen diffuses from the alveoli into capillaries to be attached to hemoglobin and be carried throughout the body. Carbon dioxide from the oxygenated blood in turn flows from the capillaries back into alveoli to be exhaled into the environment.
Now, since we all know the components of cardiovascular system, let's find out how it works. There are three different types of circulation that occur regularly in our body. The pulmonary circulation, systemic circulation, and portal circulation. And now, we were gonna talk first about the pulmonary circulation. The pulmonary circulation is extremely important within the body because its function is to take blood from the right side of the heart through the lungs for the lungs to get access for the oxygenated blood. The purpose of the pulmonary circulation is to pump blood from the right side of the heart to the lungs, where in the lungs, the blood gonna pick up the oxygen, drop up the CO2, and be taken to the left side of the heart. Let's go ahead and discuss it in detail. So, we're gonna follow each one of these vessels, chambers, and valves and gonna move through. We're just gonna number it right now and write down each number represent. So, starting from the circuit of number 1, here is the first position or what we call the right ventricle. So, the right ventricle is going to be the actual starting point of the pulmonary circulation. The next thing is, from the right ventricle is up into the pulmonary trunk. But, after that, we just need to pump the valve to the pulmonary semilunar valve. So the second thing is we're gonna move it on the pulmonary semilunar valve. So first is the right ventricle, second is the pulmonary semilunar valve. The third thing is the pulmonary trunk. It is the split point. The pulmonary trunk transports blood from the right ventricle to the pulmonary arteries. So when it is split, it goes to the right pulmonary arteries and to the left pulmonary artery. So, we're gonna number it number 4. So, from the right ventricle to the pulmonary semilunar valve to the pulmonary trunk and split it into the right and left pulmonary arteries. But, Miss Jose, arteries supposedly to be red. The answer is no. No in this situation because the pulmonary artery carrying the oxygenated blood, so it's gonna be blue. The second example for this is gonna be the fetus or fetal circulation, where the umbilical vein were actually deoxygenated. Just remember that the arteries carrying blood away from the heart and the vein bring back blood to the heart. Then from that, the arterial vein is actually exchange gases are number 6. These are going to be very, very important. Why? Because at the capillary exchange gases, we are picking up oxygen or O2 and dropping off CO2. So that's what we call the gas exchange process. The gas exchange process is actually occurring between the small structure, you know what we call the lungs, alveoli or alveoli. Then what happened is, from the pulmonary capillaries, they drain into these individual things that you see here, yung extension ng arterial vein na red color. This guys will be the number 7. It's going to be our pulmonary venules or the small veins. So recap, back to the number 5. The branch of capillaries or what we call pulmonary arterioles, and here the number 6 which actually exchange gases, which what we call capillaries, and gonna go into the small veins that called pulmonary venules, which is our number 7. Then after that, the 3 pulmonary venules come together, make up a large veins, which what we call pulmonary veins. So that's our number 8. Then you will notice that the vein are all red. I mean, it's all oxygenated. That's because we pick up oxygen and drop off CO2. So the pulmonary vein bring the blood out to the lungs and drop it off back to the heart, which is the left side of the heart is oxygenated side, wherein the right side of the heart is the oxygenated side. So now, the 9 point here or number 9 is going to be the left atrium. From the left atrium, we're gonna push the blood down through this valve, which our point number 10, the mitral valve or also known as the bicuspid valve. So from there, it ends with the little chamber here sa baba ng 10, which what we call the left ventricle. Para mas maintindihan ng lahat, let's do a last recap. The first one is going to be the right ventricle sa left side ng heart, which is the starting circuit of pulmonary circulation. And the second one is the pulmonary semilunar valve. Next is pump it on the pulmonary trunk. Then, from the pulmonary trunk, we distribute it on the right and left pulmonary arteries. Then, after that, the pulmonary arteries broke down into different parts of small arteries that called pulmonary arterioles. Then, from the pulmonary arterioles, there's gonna be a gas exchange because of picking up oxygen and dropping off CO2 or what we call the pulmonary capillaries. Then, after the pulmonary exchange of gases, the pulmonary capillary is going to be small veins or what we call the pulmonary venules. Then, the three venules come together and form a bigger or fat vein, which what we call the pulmonary vein. Then, after the pulmonary vein carry blood back to the right side of the heart or the oxygenated side of the heart, the left atrium. From the left atrium, we're gonna pump blood down through the valve or what we call the mitral valve or bicuspid valve. And the last structure is going to be the left ventricle. This is going to be the end of pulmonary circulation. Now, let's go naman sa systemic circulation.
The systemic circulation provides the functional blood supply to all body tissue. It carries oxygen and nutrients to the cells and pick up carbon dioxide and waste product. In detailed explanation, oxygen-enriched blood will return from the lungs through the pulmonary veins and now fill the heart left atrium. This will contract and the mitral valve will open, which will pump the blood into the left ventricle. As soon as the left ventricle is filled with the blood, the mitral valve will close. This action clearly prevents the blood from flowing back into the left atrium. The left ventricle will contract and the aortic valve will open. The oxygen-enriched blood will flow into the aorta and this will be distributed in every organ of the body via blood circulatory system. The aortic valve will quickly close to prevent blood from flowing back into the left ventricle. At the same time, a new contraction will take place into the right ventricle, and by this, systemic blood circuit begins a new cycle.
Next is we have the portal circulation. The liver is unusual in that it has a double blood supply. The right and left hepatic arteries carry oxygenated blood to the liver, and the portal vein carries venous blood from the GI tract to the liver. The venous blood from the GI tract drains into the superior and inferior mesenteric veins. These two vessels are then joined by splenic vein just posterior to the neck of the pancreas to form the portal vein. And this then splits to form the right and left branches, each supplying about half of the liver. On entering the liver, the blood drains into the hepatic sinusoids, where it is screened by specialized macrophages, cover cells, to remove any pathogens that manage to get past the GI defenses. The plasma is filtered to the endothelial lining of the sinusoids and base. The hepatocytes. These cells contain vast numbers of enzymes capable of breaking down and metabolizing most of what has been absorbed. The portal venous blood contains all of the products of digestion absorbed from the GI tract. So all useful and non-useful products are processed in the liver before being either released back into the hepatic veins, which join the inferior vena cava just inferior to the diaphragm, or stored in the liver for later use.
Diseases, illnesses, and complications of the circulatory system. Abnormal heart rhythms or arrhythmias. Arrhythmia or dysrhythmia occurs when the heart beats unevenly or irregularly. And in general, heart arrhythmias are grouped by the speed of the heart rate. For example, tachycardia. Tachycardia is characterized by a heartbeat more rapid or faster in comparison to the normal rate. Tachycardia may be a response to stress, anxiety, or the overconsumption of caffeine. If tachycardia is not treated, it may weaken the heart and cause other additional heart issues leading to death. The second one is bradycardia. Bradycardia is characterized by a heartbeat slower in comparison to the normal rate. Bradycardia can be dangerous if it prevents the heart from pumping the blood that the body needs in order to do its functions. The causes for abnormal heart rhythms or arrhythmias can be pre-existing or acquired heart conditions, a previous injury that healed badly, or healing process from surgery, electrolyte imbalance, and stress. And as for the treatment can depend on the type and severity of the arrhythmia. And in some cases, treatment is not necessary. Treatment options can include medications, lifestyle changes, invasive therapies, electrical devices, or surgery.
Congenital heart disease. CHDs can be present at birth, which affects the structure and function of a baby's heart. Cases may vary from mild cases, like the appearance of a little hole in the heart, to severe, such as missing or poorly formed parts of the heart. The causes is the question of why CHDs are present in babies is still unknown. In some cases, however, it is believed to be caused by changes in the genes or chromosomes, lifestyle, health condition, and diet of the pregnant mother. Here's the possible treatment. The treatment depends on the type and severity of the present defect. Some affected infants or children may need one or more surgeries to repair the heart or blood vessels. Another viable option for some cases can be done without undergoing surgery in a procedure called cardiac catheterization. A long tube called a catheter is threaded through the blood vessels into the heart, where a doctor can take measurements and pictures to test or repair the problem. Although the procedure does not guarantee to fully mend the defect in all cases, at the very least, it could provide comfort by improving blood flow of the heart and its other functions. An important note is that even if their heart defect is repaired, many people with CHDs are still not cured.
Coronary artery disease. Coronary artery disease, or CAD for short, is a common heart condition that occurs when the major blood vessels supplying the heart, or the coronary arteries, have difficulties in delivering sufficient blood, oxygen, and nutrients to the heart muscles. It can be due to the blockage caused by cholesterol deposits or plaque in the heart arteries. CAD can be caused by atherosclerosis, or the buildup of cholesterol and other substances over time because of bad habits. And bad habits can include smoking, not doing enough physical activity or exercise, ingesting too much red meat or oily foods can cause the plaque to accumulate in the arteries, resulting in partial to total blockage of the coronal arteries. And as for the treatment, unfortunately, there is no cure for coronary artery disease. Once a person is diagnosed, a change in lifestyle is the only solution to avoid developing more complications in the heart.
Rheumatic heart disease. Rheumatic heart disease is a condition in which the heart valves are damaged by rheumatic fever permanently. Damage to the heart valve could start soon after streptococcal infection, like strep throat or scarlet fever that is left either untreated or undertreated. The immune response causes an inflammatory condition in the body, which can result in ongoing valve damage. Rheumatic heart disease is caused by rheumatic fever, an inflammatory disease that can affect many connective tissues, especially in the heart, joints, skin, or brain. The heart valves can be inflamed and become scarred over time. This can result in the narrowing or leaking of the heart valve, making it harder for the heart to function normally. This may take years to develop and can result in heart failure. Rheumatic fever can occur at any age, but usually occurs in children's ages 5 to 15 years old. There is no possible cure for rheumatic heart disease. Treatment can only help manage symptoms and may delay disease progression. The treatments include medication. Your provider may provide or recommend medication to manage an abnormal heartbeat. Anticoagulants or blood thinners can reduce the risk of stroke or blood clots. The other is surgery. Severe rheumatic heart disease may need heart valve surgery. A surgeon may repair or replaces the damaged heart valves.
Huminga na lang ng malalim si Christina at bumalik sa kanyang pagme-makeup.
Sige siya. At least meron.
Okay lang. Maganda naman ako eh.
Sabi ko sa lolo. Parang katinalo ko las-las.
First day high! Nasasabik sa unang araw ng eskwela. Taas kamay with confidence. Let's do the first day high! Iba't iba ang hilig, magkakasundo sa trip. Kung gusto mong sumama, welcome